Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
I mean, if things are angry in there and then you're going to do a surgery, things are going to be angrier more than likely. But also, if you have a loss of motion, surgery is at the end of the day intended to fix the problem, but it's also your body sees that as trauma. So it goes through the normal cascade of healing, right? Pain, swelling, inflammation, treading down the quad. So having all of that beforehand, getting that joint as kind of pristine as you can and the mobility back so you don't have any deficits going in, the likelihood of having a deficit coming out of it is much less. Already reestablishing that brain muscle activation is super important, as well as kind of what we call proprioception, where you are in space. So balance, strength, range of motion, getting that ahead of time will kind of keep the brain engaged, but also less likely to have issues after the surgery is performed.